It is a big emotional journey for the patient, and beside the emotional journey, it is a physical issue, pain. Patient is supposed to receive about 70 to 80 injections in one IVF cycle. Patient has to come every day to receive injection, and this is putting lot of strain on the patient emotionally, physically, and this is one of the reason that many patients they don't undertake a second cycle because they are afraid that they have to again undergo the same number of injection again and again. In this context, this entire company is bringing a new mode of delivering this injection, which is a needle-free. So patient will not be having the prick of the needle while receiving the dose, and that is going to change the perception of the patient about the IVF cycle. The patient can always think of undergoing a second cycle if needed. In future also, for future pregnancy, they can think of undergoing IVF cycle, and that is going to change the big patient scenario. That patient will not be undergoing this pain because of the injection. Regarding Folisurge, we have been using Folisurge since more than 10 years, since the time it was launched. It is a recombinant FSH, and it is giving us excellent result in terms of ovulation induction and ovulation stimulation for IVF cycles. We are getting a good number of follicles, mature follicles, which is giving us a good embryo and a good pregnancy rate in the patient. And that is very important in IVF, that we should have good pregnancy rate, good outcome, and that is why we are using this Folisurge to almost 90% of our patients we are using Folisurge. The Folisurge advantage is it is filled by mass. So it gives a specific activity, and this gives a batch-to-batch consistency. That is very important. There are many other injection brands available where we find that we buy one batch and the next batch is a different batch. There is a difference in the action, difference in the activity. Folisurge is giving us a batch-to-batch consistency. That is very important, and that is why we are persisting with Folisurge since more than 10 years. It is being used in our unit.